So I'm going to start with a general overview about measles, talk a little bit about the measles vaccine, talk about the situation that we're in right now, and then cover in broad brushstrokes, some of the work that public health has been doing. So measles, as you know, is a highly contagious virus, and it can cause serious illness and complications. The classic symptoms include fever, runny nose, cough, red runny eyes or conjunctivitis, and a few days into the illness, people develop a very classic red rash that will spread all over the body. The virus is spread through the air after a person who has measles, who's sick with measles, coughs or sneezes and puts the virus into the air. And one of the important things to know is that this is an airborne virus, meaning that the virus will actually hang in particles in the air. And after the ill person leaves, the virus can still be in the air and can still infect people. So some estimates are that up to 2 hours after an ill person leaves, the virus can still be in the air and infect somebody. The good news is that we have a highly effective and safe vaccine available to prevent people getting sick. It is called the MMR, which is short for the 3 diseases that it prevents, which are measles, mumps, and rubella. So the current situation, the most recent numbers, if you haven't seen them yet, Clark County is the epicenter of this outbreak. We have 36 cases today, and they're investigating 12 suspects. So the numbers are growing every single day. King County has had 1 case as of last week. Multnomah County also identified 1 case over the weekend. Of the Clark County cases, this is really hitting the kids hard. So by far, the highest number of cases are among children ages 1 through 10. And of those, almost all of them are unvaccinated or have unverifiable vaccine histories. So how did we get here? I wanted to bring up a really important concept, which is community immunity, or some people use the term herd immunity. I prefer community immunity, partly because it rhymes. But so the concept is an important one in how vaccines work. So on the top picture, as an illustration, the blue people are susceptible. So they're not immunized, but they're still healthy right now. And then the red people with the little circles around them are not immunized, and they become sick, and they're among us in the community. And with diseases like measles, which are highly contagious, of all those unimmunized people, 9 out of 10 will go on to be sick if they've been exposed to someone that's sick. So a very high attack rate. And as you can see in the illustration, you just exponentially get more and more illnesses and therefore more and more spread without any protection of vaccines. And the second illustration in the yellow is once we've introduced vaccine into our population, and if we have high enough numbers, even if we have sick people among us, we have walls, we have barriers and protective walls around other people, and so it does not spread. The numbers are not as high. And some estimates for something as contagious as measles is that we need to maintain levels of at least 95% vaccination rate to keep measles from spreading. So that's a really important goal for public health.
Maybe you're going to say this, and maybe I shouldn't interrupt you, but
yeah, go ahead.
A chance to interrupt. We're currently, according to the Oregonian this morning's paper, we're at 91%. So we're not currently enjoying the benefit of the so-called herd immunity.
Yeah, so I wanted to go back to the data that's available on the Oregon Health Authority. It certainly doesn't cover, let me jump ahead here and I'll go back. So for data, we have the benefit of having vaccination rates of preschool age, childcare age, and school-age children. So we know our rates pretty well there. With adults, we don't really have good numbers on that. But for children, if you look at a map of Oregon and Washington County up in the upper left-hand corner, for all vaccinations, we have, the number's actually 95% coverage rate in school-age kids, and this is last year. If we drill down into the measles vaccine, or the MMR, for kindergarten through age 12, for all vaccines, we have 95% coverage, which is excellent. And for 2 doses of the measles, mumps, rubella, it's 97% coverage. If you go to preschools and childcare, all vaccines, the numbers are definitely lower, and these are younger children. So 77% of those children have all their vaccines, and 89% have 1 dose of the MMR. So our coverage is, we're a bit more vulnerable in that younger age kid group. So definitely, if you go on the immunization program webpage through the Oregon Health Authority, they do have dots indicating the coverage rates for individual schools and child cares. There are some that are some areas of vulnerability where vaccination rates are as low as 60% for the MMR. So on average, though, our numbers are pretty good. So I want to go back to a little bit about the vaccine and to some of your questions about immunity of people who are outside of the school range. So the first effective measles vaccine came about in the late 1960s, 1968. And from there, in the early 1970s, they developed the combination vaccine, as we know it today, the MMR, which has the mumps and rubella in it as well. And then in 2005, they added in the varicella virus as well for an MMRV. And the data on the effectiveness is solid. 1 dose of MMR will give protection to 93 to 95% of people that receive it. If you get 2 doses, 97% that receive 2 doses will be immune, and that's immunity for life. So to the issue of who's protected, what can you assume, and what can you look back at your records for? What does public health consider a person being immune? So like I discussed before, if you were born in 1957, the rates of measles were in the hundreds of thousands. So there's a good chance that you were exposed, had the illness, and became immune. Another criteria that could be used is if you've had measles before. It does give lifelong immunity if you've had the natural illness. If you have a blood test to show that you have immunity, so you can check your antibody levels, and that can be documentation to prove that you're immune. And then to vaccines, because they're so effective in the pre-kindergarten age group, if they've had 1 MMR, we would consider they're very likely immune. And in school-age kids, those 2 doses. So our advice to the general public, if people are reviewing their own records, as we highly recommend people do given the outbreak, if you don't have documentation of a measles vaccine, we recommend you just go out and get an MMR. It's safe. It saves you multiple trips going back to the doctor to check your serologies or your antibody levels, and if you're low, you have to get one anyway. So our recommendation is just go get the MMR if you're uncertain. And this is a really important protection to have given what's happening in the U.S. and outside of the U.S. So I wanted to put this illustration up from the World Health Organization. It's data from June through November of last year, so a total of 6 months counts of the measles cases. And you can see in the dark colors, that's where measles is really hitting people hard. And in the red, which is where the U.S. is, that is a count of between 100 to 199 cases within 6 months. So we've had quite a few. There have been some big outbreaks in New York and now here. And so if you're a traveler, measles is out there. It's good to have the protection of the vaccine so that you don't become ill and potentially bring it back here to our community. So public health, what we do as our baseline, our routine activities to prevent outbreaks, to prevent illness such as measles. We ensure access to immunizations. So I mentioned the Washington County Resource Line, which is available to the public to call if they don't have a healthcare provider or they're wondering where they can get vaccines. We also support our safety net clinics, which provide low-cost or no-cost services to our members and also are a great way for people to access vaccines. They also are active around School Exclusion Day, which is public health's big activity leading into February, where we're really enforcing the school immunization laws and requiring that people in schools review immunization records and get up to date. Our other activities are around preparedness. So we do a lot of planning for how we would handle a large outbreak like this, and it's also generalizable to other disasters. And one of the favorite topics for exercises is, what if we have a measles outbreak? So we've certainly run through that scenario a few times. And collaborations, I can't say how important those are to build in our usual day-to-day work. And we certainly have excellent collaborations between our different local public health agencies, as well as with the state, and with our local healthcare systems and healthcare providers. We've really created great avenues for collaboration and communication for when we have events such as this. So what we're doing in response, one of our big roles is investigation. So we are getting calls multiple times a day of providers concerned about the people that are coming into their clinic with symptoms, wanting to run scenarios by us and get our recommendations. When there are some that really have some red flags, we do further investigations, we do interviews, and try to identify if somebody actually is a case by facilitating testing. And then from there, once we've identified a case, we do a contact investigation. So with something like measles, which is so contagious, we identify close contacts and make sure they get immunized or are immunized. And we also do a lot of active surveillance of people, calling them almost daily to see if they've developed symptoms during the time that they could become sick, and trying to channel them into the healthcare system in a way that doesn't get other people sick. That's a huge bulk of our work right now. And then with infection prevention control, we also do a lot of that with regard to educating our providers, our infection preventionists at our healthcare institutions, and those investigative activities to feed into the infection prevention and control. Education and awareness, as I mentioned before, we are putting out a lot of information to the public and also to our healthcare providers. We've sent out multiple alerts addressing all of those frequently asked questions that we get from them so that they can do the right thing if they see someone that they have suspicion for measles. And then again, collaboration. We are working very closely with the Oregon Health Authority, with the Department of Health up in Washington, Clark County, and with our neighbors in Clackamas and Multnomah County, as well as in frequent conversations with our health systems and providers, convening infectious disease providers to talk amongst themselves and with public health to answer their questions, as well as talking with our schools and child care centers about vaccinations and what they can do if there is a case or a case that they suspect is ill with measles. So that's a very big, broad overview. You asked for some links for good information. CDC is always our go-to. It has very comprehensive information that's really accessible to all different types of audiences, so I direct you there. For updates, the Clark County Public Health Department has daily updates on their counts and the exposure sites. That's available at that website. And they also link to King County, and they also link to Oregon for exposure sites. And Multnomah has also stood up a website, which is very good. That has some excellent information too. So.
Any questions from the board? Commissioner Willie?
Yeah, so the bookends of this, what is the youngest a child should be getting measles shot, the MMR shot, and what's the oldest?
Yeah. So there is no oldest. The youngest, the recommendations are that children start getting the MMR at the age of 1. That's not to say that they can't get it earlier. That's just when we start our recommendations. For kids that are between the ages of 6 to 12 months, they could certainly get vaccinated. It's just not recommended. And younger than that, sometimes babies, if the mother's been vaccinated, still carry her antibodies and so have some protection. And those antibodies can interfere with the vaccine if they get it too early. So the very earliest 6 months, but the recommendation starts at 1 year.
Okay, thank you.
Yeah, absolutely.
I have a question. Are we, as a county, prepared to have a website, much like Multnomah County and Clark County, if we were to have a case here?
Yes, absolutely. We have done that in the past. Certainly, we'd like to channel people to information that's relevant locally, and we absolutely can put up a webpage.
I was pretty sure the answer would be yes. I just wanted to hear you say it. Thank you.
Yes, I confirm.
And I noticed you had said state, singular, but I'm hoping that you probably really mean states, because being up in this northern part of Oregon, what goes on in Washington State, obviously, in Clark County, is, matters a lot. So what have you found the cooperation between the counties in the state of Oregon and the state of Washington?
Yeah, so we've had very good cooperation and history with Clark County. We consider them part of our Quad County area, and we meet quarterly with the communicable disease teams there. So that's a very strong relationship. And Washington State has also been a great collaborator with Oregon State. So, yeah.
You might remember Dick, Alan Melnick, who you see on TV all the time.
I remember Alan.
Used to work for Washington County.
Yes,
Yeah.
I know Alan.
Yeah.
Dr. Mill.
And Marnie Kyle used to work for Clark County.
Ah,
He did. She did, excuse me.
With Alan Melnick, among others.
got out in time before the measles.
Thank you.
We had our own
Oh.
outbreaks when I was there, so.
Well, thank you, Dr. Baumann, and to Marnie Kyle. I'm learning, I'm teachable, for getting information together for us so swiftly so that we can ensure we're doing our best to inform everyone here in Washington County, so.
Well, thank you for
fingers are
giving us that
crossed.
opportunity to inform our public. It's great, thank you.
Thank you.
Thank you.
Thank you.
Have a good night.